It is time now for our Ask the Expert segment, and today we are talking about healthy kids. We're excited to welcome Dr. Leah Hillier from Banner University Hospital to the show. You're a family doctor, so you're here to answer all the questions. Remember, 602-444-1212. So here's our first question from one of our viewers.
My name is Erin Willis. I'm from Scottsdale, Arizona, and the question that I have is, how can we increase the trust that parents have in the medical community and make sure that we're getting the most reliable information and scientifically and research-backed evidence to support vaccinations in our community?
That's a big, hot issue right now with vaccinations.
It certainly is. Certainly is. And you know, it's a complex issue. We were talking before the show about this polarization that's come around, people saying, I'm pro-vaccination, I'm anti-vaccination. I think that sort of verbiage doesn't help any of us. I think what we all need to be is open to conversation and talking about vaccination. So what I would say, I think the most important thing for us to do here is open the conversation and talk about vaccines. Let's talk about risks. The best way to do that is to see your primary care provider. And you know, we all should have a healthy skepticism about health choices. So you know, when you start a medication, ask about side effects. When you have an immunization, ask about side effects, ask about risk. And I think, you know, your healthcare provider should be able to provide lots of information about that and direct you to evidence-based resources. You know, the internet has so much information. The problem is it's hard to differentiate what's really good information and what's evidence-based information. Right. So your PCP or your primary care provider can help you to direct to places to make really informed decisions about vaccines.
Can I ask what you tell your patients?
Absolutely. So, you know, most vaccinations are studied quite extensively, and so they do go through a process where scientists, bureaucrats who, you know, get no glory from it, spend their lives researching the safety and efficacy of these things. And generally, health professionals, you know, I vaccinate my son, and I'm very happy to tell my patients that. I get every vaccine that I can get because I really believe in vaccinations. When you look at the evidence for risk and benefit, I mean, the benefits greatly outweigh the risks. That being said, you know, parents should have healthy skepticism. They're trying to take care of their children, and people should ask questions before they make any health decision.
Okay. Here's our next question from another viewer.
My name's Alan DeChellis, and I'm from Gilbert, and I was wondering, at what temperature should I take my child to go see a pediatrician?
Oh, that's a good one too.
That is, and I wish I had a really nice, simple answer. There's not a simple answer to this one. Now, let me first talk about fever, because that's important. So what is a fever? Well, the body's natural response to an infection, which is the most common cause of fever, is to raise the temperature, and that makes the body less hospitable to organisms like viruses and bacteria. So it's part of your body's natural defense to an infection. So fevers are normal and healthy. A healthy body will develop a fever.
Okay.
That being said, sometimes fevers are an indication of a scary infection. So as a clinician, my choice when I'm looking at a child is always to say, is this a bad infection or an infection they're going to get over, something that they can handle? That isn't really determined by what their temperature is. So as a parent, the definition of a fever is going to be above 38 degrees Celsius or just over 100 degrees Fahrenheit.
Okay.
So if you have a thermometer at home, you can check. The best temperature is a rectal temperature, but lots of parents don't feel comfortable with that, so an oral is fine.
Sure, yeah.
An oral is fine. And if you're not sure, of course, you can take the child in and have their temperature checked. But the more important thing that I always emphasize is, as a parent, look at your child. Do they look well, right? Are they eating normally? Are they drinking normally? Are they peeing and pooping normally?
Yeah.
Do they look tired, lethargic? Are they not themselves? Those things are far more important in deciding to take your child in than the temperature that you get, because lots of kids are going to have a cough and a cold and get a fever, and they don't necessarily need to see the doctor.
Okay, all right. A quick question from one of our Text Team 12 viewers. Are children encouraged to drink power drinks like Gatorade or Powerade, or stick with water during the summer? That's from Bill in Mesa.
Yeah, great question. So there have been actually a lot of studies where we've looked at the benefits of Powerade and Gatorade, particularly in like endurance athletes. So people who are sweating a lot, they don't see a heck of a lot of benefit in Powerade and Gatorade over just plain water. Now, assuming your child is not doing ultra marathons, which most kids aren't, water is probably totally fine.
Okay.
So making sure that your kid has a balanced meal and is eating normally, they're going to get all the salts and sugars that they need, and the hydration really comes from water.
Okay, and don't you have to be careful? Sometimes they're very caloric with all the sugar.
I mean, there's tons of sugar in there, and with kids, we generally, especially with young kids, we recommend stay away from juice, stay away from soda. And so, you know, unfortunately, a lot of those drinks, even though they're sold as health beverages, they have a lot of sugar in them.
Yeah, Dr. Leah Hillier, you are great.